under negative pressure so that the air was exchanged and vented to the exterior of the building. That patient remains in our inpatient service. They remain in good condition. At 11 o'clock this morning, we were able to arrange through the help of the state and local officials to have a specimen transported to a lab, one of the reference laboratories that's been approved to provide this testing service. And we're expecting that we should have the preliminary results of this test sometime in the next 24 hours. We're hoping that it be much sooner than that, but we'll be making individuals aware as soon as we receive the results of those tests. So I should stop there and turn it back to Vin if there are any questions.
Mayor or Tom.
Question, Doctor. If you can tell us why Yale University was so sure that these two researchers who were in Liberia did not need to be quarantined.
And I turn it to the university representatives that are here to answer that question. Dr. Alpern is on the left, not the right, excuse me.
So I think this was done in coordination with the CDC, and it was based on the fact that these students had no contact with any patients who were actively sick from Ebola while they were in Liberia.
Can I have your name and title, please?
I'm Bob Alpern. I'm the dean of the medical school.
Has the university or the hospital been in contact with the people that this student was living with, or have they had any other interaction with people, outside people?
So we've been working in conjunction with the state and local officials. This individual patient's contacts are going to be contacted and followed up through the normal channels that the Department of Public Health would follow.
Do you know how many people we're talking about?
I don't know the answer to that question.
Doctor, could you take us through the process last night of how the person was kind of isolated, so to speak? We get people saying what they saw. So can you just kind of explain what the policy is and how to,
Sure. So for the specifics of how we conduct our infection control processes, I'm going to turn that to Dr. Louise Dembry, who's an expert in infectious disease and hospital epidemiology infection control.
So thank you. We've been, as Dr. Balsasak, been planning for this for several weeks, if not several months, and we had already identified where we would put this patient in isolation and precautions following the CDC guidance and actually going above and beyond that. And we had planned where we would not only move the patient from the emergency department but through the hospital and do it in a safe way, and everything went just the way we planned last night.
Can you talk to us about the suits you use? I'm hearing there's a level 4 suit and level 4 suit versus a fluid-resistant suit. Can you tell me what that patient is transported with?
Well, there's a variety of different types of personal protective equipment that's available. We had chosen at this point in time to go to a higher level, not knowing in what condition that the patient would come. And so we were using something that's called, I think it was a level 3 suit, a biohazard suit that we have in our emergency department, and we train people to use that.
Mayor Harp said that this was likely to be Ebola. Is that the medical consensus as well? Is there a reason for that?
I would say that the patient's in stable condition, in good and stable condition, and that we'll have a test done in the next 24 hours. Beyond that, I'm not willing to speculate.
Is his primary care doctor being monitored, or all the other people that he's been monitoring?
Again, the DPH and the state and local officials are taking care of making sure that the immediate contacts of this individual are being monitored in the appropriate way.
Is the primary care physician still practicing at work?
I don't have a comment on that.
Do you feel that the procedures you followed here at Yale-New Haven are better or about the same as the hospital in Dallas, where there's 2 nurses were infected?
I mean, I'm not willing to speculate on what they followed or did not follow. I can only say that we were, in conjunction with our nursing staff, the hospital epidemiology, infection control staff, and all of the other staff that come in contact with the patients, we had provided the equipment that we believe is at the right level. And you've seen in the media that there are reports that the CDC recommendations have been evolving. We monitor those very closely, and we believe that we are ahead of those recommendations with the level of protection that we are providing. So I believe that we provided what we think is appropriate for this patient in this situation at this time.
You said this is the patient had traveled to one of those countries. Is this one of the two Yale researchers? And if so, what about that other student?
So as a patient, in the care of this institution, I'm not willing to name that patient or speculate. I'm not willing to speculate on where that patient comes from at this time.
Dr. Balsazak, can you tell us how many members of the medical team will care for a patient who is suspected of having Ebola-Like symptoms?
Right, so we're trying to limit it to the minimum number possible. We have 2 attending physicians that are caring for this patient around the clock. Those individuals are critical care trained, and they're also trained in internal medicine, but they're experts in the whole range of medical diseases in the conditions that this individual may or may not experience in the next 24 to 48 hours. In terms of the nursing staff, as I mentioned, our policy and practice is to ensure that there are 2 individual nurses that are going to be caring for this patient, one that's caring for the patient, and one that is ensuring that that nurse is donning and doffing, that is taking on and putting on and taking off their equipment in the appropriate fashion, something that we thought was necessary to ensure that the equipment is used correctly and, most importantly, removed correctly after use.
There's only 4 individuals that are in direct contact?
No, that's not what I was saying, is that at any one time there will be 2 nurses, and those nurses will, of course, rotate according to their shifts and their fatigue levels and so forth. And there will be others caring for this patient as well as necessary, but we're trying to limit the number to whatever extent we can.
Can you give us an estimate of how many that would be?
I don't know the answer. I don't know the answer to that question.
Excuse me, what, you said that someone else had asked this, but can you eliminate whether it is one of the 2 who traveled to Liberia?
I'm not willing to comment on that, no.
Doctor, you talk about the location where the person was, I guess, you described them being sequestered, working with a primary physician. What's happening there as far as preventive measures to make sure?
What's happening where?
At the place this person was outside the hospital before they came to the hospital last night.
Again, I would refer that to the Department of Public Health and the state and local individuals that are caring for that.
Was that patient married or have any children? Is there a risk
we
there?
can't speculate on.
Some people may be afraid to their own children that they could have exposure. I mean, I think without giving the identity, I think that's very valid. To say if they had children, it could be a risk for children in the community. Can you at least say if they had children?
I can't, but I will state something that's important to realize, which is that individuals that don't exhibit symptoms, meaning they're not having nausea, vomiting, diarrhea, and a fever, importantly, are asymptomatic individuals. And as soon as this individual recognized that they had a fever, they contacted their primary caregiver and was referred to our facility. So I don't know when exactly this individual, if they are, I don't know when exactly this individual established their fever. When they did, they appropriately contacted their provider and sought a higher level of care with us. I can't speculate as to who was exposed or when a potential exposure could have happened.
The only reason I'm asking about this question is because children have close contact with each other. They will come into contact with each other's fluids. And if you're not saying if these people had children or not, that could be concerned in the school system.
Yes, I'm not saying that they did or didn't. I'm saying that the DPH is handling that.
What happens to linens and stuff that gets taken off? Is there any equipment or linens that this person soils that's covered in their bodily fluids? Where does that go?
So as Dr. Dembry noted, we have been preparing for this for some time now. We've been working with our environmental services staff and also with the folks that deal with our linens and with our trash and with our sterile equipment. And we have those policies and processes in place to ensure that we are adhering to the highest standards for the disposal of those linens and for the cleaning of the equipment.
Where do they go?
Louise, would you like to comment?
We are following what our vendor or contractor for waste management is recommending, which has been vetted by the CDC and others for the regulations, and so we are following exactly what they said. At this point in time, since we don't know yet the results of any testing, everything is basically staying with the patient, and once we have the results of the test, then we can further handle the waste.
Who was doing that testing? Where was that specimen sent?
So, you like to comment? Go ahead.
Excuse me?
The LRA.
Oh, yeah, I believe it went to Massachusetts. Yeah.
Dr. Balsazak.
I'm not sure of where that lab is in Massachusetts. It's a state lab in Massachusetts.
So we've been asked to coordinate and send our specimens as a healthcare industry to a small number of centers, given the potential for exposure during the testing if a test turns out to be positive. And so there are a small number of centers that are actually doing the testing.
Mayor, can you say whether this individual's home has been sterilized or disinfected at this point?
What I can say is that our Livable Cities initiative is looking into this, and we'll be making a determination soon.
Dr. Balzac, follow up on Ebola itself. Are there several strains of this virus, and if so, could it possibly become airborne?
I can only speculate. I'm not an infectious disease expert, but to my left is one. And I'll tell you, at this point, it is not airborne. It's an important point. We have put the patient in a negative pressure room out of an abundance of caution, and I can't speculate as to whether it would mutate or migrate. Dr. Dembry may be able to do that for you.
And to answer your question, yes, there are a variety of different strains that cause Ebola in Africa. This is one that's been pretty common in Central Africa and has caused outbreaks before, and I believe that, you know, since these been travelers that have brought it to the United States, it's the same strain.
Is it possible it could become airborne?
So let me stop here and say that, remember, we do not have a confirmation that this is an Ebola case. This is a suspected case, and we have an abundance of caution here that we are testing that patient, and we should know that within the next 24 hours. But for the time being, we are treating this as a suspected case, and we're following all the practices and policies as if this were an actual case. And we should know more about that within the next 24 hours.
Is the patient in the medical ICU or surgical ICU?
I'm not willing to speculate where they are. They're in a safe location. It's in a negative pressure room. They're being cared for by the appropriately trained staff.
If your patient still have fever, what are their symptoms now?
The patient has had a low-grade temperature. Their condition has improved since admission, and they are quite stable.
Dr. We spoke to someone who was in the ER last night, and from what he said, everyone was kind of ushered outside. Can you talk about those precautions? I mean, if you had the plan of the person being in isolation and taken in and walked through that sort of thing, why get all those people out?
Again, I think you've seen that the CDC has evolved its recommendations over time. And if we are able to move staff away, for example, from an area that a patient is being transported through, and it doesn't disrupt our operations, it doesn't disrupt patient care, we thought that why not do that?
Doctor, if a patient comes back to be positive, will you remove that patient from the negative pressure room into a more highly guarded or more isolated room, a different one?
Sure. I think that the answer to that question is let's wait 24 hours and see what the result is, and we'll be able to come back to you with further information at that time.
But do you have the ability to do it, and if so, what's the level of preparation that you have?
The level of preparation for which?
In terms of a different room, a different facility with more equipment.
Let me start here, and Dr. Dembry can finish. The facility that the patient is in is absolutely adequate to care for a patient with Ebola. Whether or not we choose to treat that patient here is going to be a discussion if and when that actually takes place. Louise, would you like to answer?
So a negative pressure isolation room is something that we use for some of the more contagious infectious diseases, particularly spread airborne. Again, Ebola is generally not spread airborne, but we are erring on the side of caution where we're trying to figure out the diagnosis.
Dr. you ever talk about, is there anybody else in the community being kind of monitored by the primary physician, like was the case with the person who's now?
I don't have that information.
Just one more question, please.
Mayor, are you doing anything to help the workers who are going to be going in the community and maybe dealing with people like this? What is kind of being done to try to make sure that they're safe?
So we are using the CDC protocols for our personnel, and we have the equipment that they need should it be necessary to use it, and all of our personnel have been informed about those protocols and are prepared to use them if necessary.
Doctor, is an Ebola case, can you speak about the therapies that are available to a patient?
No, I can't.
Thank you, folks.
Then, can we do one for Bob Alpern, one more, please? Just the question that I had was, there was, I guess, an alert issued to suggest no travel to West Africa, and this student researcher had left just prior to this alert, I understand. Could there have been word that was gotten to this student researcher to make them return, or it was just a suggestion?
So we have developed actually in the last week or so a policy for travel. So we're not banning travel to West Africa, but the bar to go there is going to be very high. So there's going to be lots of limitations before we would approve a travel as part of their being a member of Yale. We have no control over any member of the Yale community choosing to go on their own. But we do control whether they go as a member of the Yale community. And I can tell you the restrictions will be very severe, but they really need to be, it really needs to be necessary. Their skills need to really be required by the community in West Africa, and there needs to be a sponsoring organization that really knows what they should be doing there. So all of that will be used going forward. These students who went really, I think they were not going to have contact with Ebola patients. Our understanding is they did have contact with one person who eventually developed Ebola, but he didn't have it and he wasn't symptomatic when they had contact.
Which makes it not contagious.
Right.
Thank you, folks. Thank you. We'll keep you updated as we have more information.
Thank you very much. Appreciate it.